I think, like, for example, in the fields where I feel most fulfilled, or the disorders, I should say, where I feel most fulfilled is in migraines. Because I feel like we are, as neurologists, we're pretty effective, if we know what we're doing, we're pretty effective in figuring out what type of medication to give to the patient. Of course, ultimately, it's the patient's responsibility to be on those medications, of course, because if they don't take it, we can't do anything for it.
Right.
But other type of disorders I feel really fulfilled when I treat is a person with Parkinson's, for example, because even though we can't reverse what's going on in their brain because they are losing brain cells, there are lots of medications out there, especially classic old medications, that you really see before and after. And it's amazing, as a neurologist, to see that.
So you're not curing it, but you definitely see a difference.
Right. You give them a good quality of life. That's what it ultimately comes down to, is can you improve their quality of life?
Is that what you keep at the forefront of your mind as a doctor all the time? And you try and keep a zoomed out focus on, with everything you do, am I improving the quality of life or am I not in the macro? And does that determine like the specific micro stuff that you do? Is that something that you think about often, or are you just focused on the treatment and the specific?
It's a little bit of both. It's for example, in migraine world, we have to consider offering patients medications once their migraines are more than like 4 a month, or if they have two migraines a month, but they're very debilitating, or they don't respond to medications. Per guidelines, the American Headache Society, you have to offer a preventative, right? So it's a cost benefit type of thing, right? You could give a medication, but then any medication, even supplements, can carry side effects. So you have to look at it as a whole, and ultimately it's the patient's decision, right? You can't force it on a patient. You give him options. You go over the pros and cons of each, and hopefully your patient can make an informed decision and go from there.